we've learned about screening. That brings us to treatment, because that's part of the picture here. So what can someone expect if they are diagnosed with diabetes? How do we treat it now? And how successful are we at controlling it? And yeah, let's start with that.
Okay. So again, in type 2, we look towards the medications that we have, and we also look towards the lifestyle. Because if you treat patients with medications, but they don't conform to a certain lifestyle change, the poor lifestyle change could probably overcome the medications. So they have to conform to lifestyle changes. They have to eat certain foods, prevent their blood sugars from rising by not having simple sugars. Same with type 1s. On the other hand, we have medications that they can take by mouth for many years that can control their blood sugars quite well. And these are, we now have almost 12 medications of different types that we can use individually, we can use them in combination, and so there's no excuse not to keep your blood sugar fairly normal. Eventually, as the body deteriorates, one moves towards injectables. And we're actually moving towards using the injectables earlier, together with the oral tablets. And we're able to keep the blood sugar fairly close to normal, particularly in a younger individual. When the individual gets much older, we have to be a bit more careful, because one of the side effects in the much older patient is that they already have some large vessel disease, and we don't want to cause any complication just from the medications. But individuals who are newly diagnosed, and probably for the next 20 years, can have excellent control and delay the complications.
That sounds very important. You mentioned that there's a lot of different oral medications, tablets that can help with blood sugar control, and then injectables. And when you say injectables, does that mean insulin, or are there other kinds of medicine that are injected to help control diabetes?
Well, so recently insulin was the injectable that we had, which was very useful. But we now have a new group of injectables. They are called incretins, and they actually help you lose weight. They actually don't cause the hypoglycemia, which are two of the aspects that our diabetic patients are very nervous of, particularly with some tablets, but certainly with insulin. And we even have a way of now combining them, this incretin injectable with an insulin injectable. So things are advancing all the time, and improved medications are coming along all the time.
So now you mentioned hypoglycemia, which, as most people know, means the blood sugar goes too low. So somebody who's being treated for diabetes with medicines to help the insulin work better could get hypoglycemic. What would they experience if they were getting hypoglycemic, and what should they do?
So if you become hypoglycemic, there are two aspects to it. First of all, there's a neurological aspect whereby you will start shaking, your pulse will go fast. It's called the sympathetic effect. And then, of course, if it goes too low, you'll start feeling lightheaded and dizzy. And all of these together would make you suspicious that you are dropping your blood sugar. Just by eating, imbibing sugar, you can overcome that. If it becomes severe, especially in type 1s, we often ask the type 1s to carry an injection of glucagon, which opposes the action of insulin. And that's an emergency response which will allow them to overcome the hypoglycemia. There are experiments ongoing at the moment with devices that give both insulin but have the glucagon available depending on if the blood sugar's falling too fast. And that's being experimented on by many individuals in type 1 patients.
I see.
Type 2 patients, the hypoglycemia is not usually as severe, but if it happens, they need to take in some form of sugar. A lot of diabetics walk with sweets in their pockets to do that. We hope that they only use the sweets when they need it, and they don't take it when they want it.